appreciate the discussion. And we talk a lot about health care reform in this body and other legislatures across the country, and we're talking about it at the federal level. And I would just remind you that we've been talking about health care reform for decades, 2-3 decades. And what have we seen as a result of all that discussion? We've seen more and more government involvement in what used to be a marketplace for health care. And we don't have that anymore. And every time we run up against a particular problem that we've detected because of some reform we did previously, the answer is always, well, we need more government. And of course, we need more taxation to pay for that. One of the points that was raised in the debate we had was that we've been trying for years to raise the hospitalization cap in Minnesota Care. Now, why hasn't that happened? I think everybody says, well, that's a good idea. Why hasn't that happened? And I think it hasn't happened for the very simple reason that it would be very, very costly to the state to do that. And who's going to pay for that? Taxpayers have to pay for it. And there's been no way to determine how to give that higher level, whatever the cap is, determined to be. How do you pay for that? And this is part of the problem. We talk about health care reform, but we don't talk about trying to create a marketplace for reform, trying to create a marketplace to allow people to make decisions and to create the incentives to provide more choices and more opportunity for people to make decisions. A lot of the debate that we've had on this issue presumes that people who are low income are not capable of making good decisions about their health care or about their behavior as it affects their health care. And I think that assumption is wrong. We all make those choices, all of us. We should presume that everyone is capable of doing that, and we ought to create a marketplace that presumes that people are responsible, want to be responsible, and we should do that. The current structure we are on is not fiscally sustainable. We know that. It talks about the trends in health care going up 8 or 10%. Our HHS budget, which is the biggest part of our state budget, is forecasted this year to increase by 22% over the previous year. Now, that's not all health care costs. But the point is, having government try to manage this doesn't work. We don't try to have government manage our food distribution system or our manufacturing economy or our retail economy, but we say we want government to manage this particular part of our economy. And it doesn't work, and we've been on this path to experiment for years. Now, this bill does not reform the health care system. It is not a panacea. It doesn't do all the things that need to be done, but it is a step in the right direction, and we need to take that step. What it does is it provides people an opportunity, and to the extent that they need help, to participate in a marketplace. And that very act of giving more people access to participate in a marketplace is going to create a dynamic that will, I believe, create more choices in that marketplace and create the incentives to bring about greater transparency. Because when people are spending their own money, they want to know what it's for. When somebody else is paying the bill, people have less concern about what they're getting. And that's part of the, I guess, the idea behind this bill. Members, at some point we're going to have to get serious about real reform in health care. And real reform means giving people an opportunity to make choices and helping people who need help to do that. And we've heard talk about how this is unaffordable. And remember, this is for low-income Minnesotans, 133 to 250% of poverty. To the extent that any of those individuals own cars, their out-of-pocket expense for their transportation would exceed any of the anticipated out-of-pocket expenses for a health care plan. This is not impossible for people to do. We think that this is a good plan. We think people should embrace this plan. We have got to find a different way to do health care than continuing to create a excessive bureaucracy, trying to make decisions in legislative committees about what things should cost and what is transparency and how do we define questions we don't ask about any other sector of the economy. Those kinds of decisions are not appropriate, I don't believe, for legislatures to make. Those are decisions made in a marketplace. And our job as policymakers ought to be to try to encourage the development of a marketplace. And this is a step. It doesn't solve all the problems. There are other things we need to do, but this is a step. So, members, I would encourage your support of the bill and ask for a yes vote.